Hi guys, again we are here with a new video, and this is very informative video. Please watching it, and please keep sharing these videos because these are based on only awareness. These are not based on commercial things. So you must share these videos to the people who they do need a good information for hair transplant surgery. So we will talk about frontal forelock. Frontal forelock is just behind the hairline, and what we want to do is we want to produce a bulk of hair inside the center of the frontal scalp, center of the frontal scalp, and tail of the frontal forelock. It touches the mid scalp area. So we need to give you the information that why this frontal forelock is made in the frontal scalp. This is dense area, relatively dense area to the sides and to the back of the head. Why we produce the frontal forelock? This is 3 into 3 centimeter, 4 into 4 centimeter, and depending on the surgeons who they want to produce frontal forelock for the patients to give them a natural and dense look in the frontal scalp. This is the idea behind this frontal forelock. But the surgeons they consider it according to the diameter of the head and circumference of the head. If head is wide, they're gonna keep it like 4 into 4 centimeter frontal forelock, and the few of them they produce like 3 into 4 centimeter, 4 centimeter long and 3 wide. Some surgeons they do it like 3 centimeter wide and 3 centimeter long, and they put a good density up to 35 follicular units in this frontal forelock area. And moreover, they want to do it like they want to put multiple unit grafts in this area to give a good density behind the transitional zone of hairline, so that frontal forelock 3 into 3 centimeter or 4 into 4 centimeter area, if it is very dense and having a multiple unit grafts, the sides will also be give you a good see-through effect from both sides, from this side and from frontal side. But keep in mind, once someone is producing frontal forelock, the direction and angle of the hair, to me it should be created in a flares, so that it can give a very good natural look while combing on this side or in this side. So the importance of frontal forelock in hair transplant surgery, while we are losing 30,000 grafts in this area, whole area, and only 8,000 grafts from the frontal scalp. So with a limited number of grafts, creating a good natural look density in the frontal scalp, frontal forelock is having its own importance. So I wanted to give you information on this. Maybe some of the doctors may be reducing this frontal forelock in the future surgeries in their offices. But keep in mind, without learning from a true expert, you should not be trying anything, because you should see them how to produce frontal forelock, how to give natural look, how to make flares in the frontal forelock, because this is more important to give direction and flares in the frontal forelock area to produce natural density looks. So natural dense look. So you need to be a student of your subject every time, because I have been learning from others every time. So my objective to the doctors is especially to say to them, learning does not stop in the lifetime. Thank you very much. Keep watching these videos. These are informative to the patients, and please do share these videos because this is not commercial. Thank you very much.